You wake up, grab your coffee, check your phone, you feel completely fine. But what if, inside your body, something invisible was quietly setting a countdown? That's not a scene from a movie. It's the reality of the diseases we're talking about today. They don't arrive with a dramatic explosion. They creep. They whisper. And they become dangerous precisely because you don't notice them until the stakes are sky high. We're going to walk through some real-world scenes, not to scare you, but to show you how ordinary choices and missed checks can change everything. By the end, you'll have a practical plan, not a sense of panic. Let's start with the classic silent killer: high blood pressure. Picture a woman in her 40s. She thinks headaches or dizziness are the only signs that matter, so she never gets her blood pressure checked. For years, her arteries take a slow, invisible beating from that elevated pressure. Tiny injuries form, making plaque stickier and forcing her heart to pump harder. There are no alarms, no warning bells, until one day, a heart attack or stroke makes the problem painfully obvious. This is why it's called silent. It often has zero symptoms, but is a leading cause of premature death worldwide. The good news: it's one of the easiest threats to track. A blood pressure cuff at a clinic, a pharmacy, or even at home takes just seconds. Regular checks, lifestyle changes, and inexpensive medications save lives every single day. Linked to this is atherosclerotic cardiovascular disease. Think of it as the slow, silent narrowing of the pipes that feed your heart and your brain. Imagine an active man who assumes chest pain will be dramatic and unmistakable. But his coronary arteries have been clogging up for decades. One day, a plaque that formed over years suddenly ruptures, creating a clot. A routine treadmill run becomes the last thing he ever does. Risk factors like high cholesterol, smoking, and diabetes speed up the process, but they don't make it feel loud. This is why doctors use screening numbers from your lipid panel, blood pressure, and diabetes tests to estimate your risk. When it's appropriate, they might suggest statins or other preventive measures to stop a catastrophic event before it ever happens. Prevention here is literally thinking ahead to interrupt a silent chain of damage. Infectious diseases can also be incredibly quiet. HIV is a well-known example. After the initial infection, some people get a short, flu-like illness and then feel fine for years. During this time, the virus is slowly chipping away at their immune system, and it can still be transmitted to others. But here's the game changer: modern antiretroviral therapy suppresses the virus so effectively that a person with an undetectable viral load cannot sexually transmit HIV. This is known as UU. Undetectable equals untransmittable. It transforms a once fatal diagnosis into a manageable chronic disease. But this only works if the infection is found and treated. Affordable, non-judgmental testing is the key that turns the tide. Hepatitis B and C are even quieter for many people. Imagine a young adult who had a medical procedure years ago, or maybe used a non-sterile piercing tool. They felt fine, so they never got tested. Decades later, they show up in the emergency room with jaundice or internal bleeding because their liver is already severely scarred. Hepatitis C, in particular, often causes no early symptoms. It can smolder for years, slowly causing cirrhosis and liver cancer. But here's the modern miracle. Hepatitis C is now curable for over 95% of people who get treated. Hepatitis B is preventable with a vaccine and controllable with treatment. The message is simple: your past exposures matter. Testing is straightforward, and when caught early, the outcomes are far better than you might think. Tuberculosis has its own version of being silent. Millions of people around the world have latent TB. This means the bacteria are alive in their body, but aren't causing symptoms or being contagious. Most of these people will never get sick. But for some, especially if their immune system weakens, the infection can reactivate years later. Imagine a caregiver who was exposed decades ago. They only find out when they develop a wasting, coughing illness that they then pass on to others. The good news is that public health programs can identify and treat latent TB before it ever reactivates. Finding and treating what's invisible prevents what would otherwise be a contagious and catastrophic illness. Cancer is probably the most familiar silent threat. Many tumors grow without any obvious signs until they're advanced. Colorectal cancer is a textbook example. It often starts from polyps that cause no symptoms. These polyps can be found and removed with screening tests, like a colonoscopy. When we get screened at the recommended age, we catch these precancerous growths or early cancers when they're highly curable. When we don't, people can end up in the emergency room with an obstructing tumor or cancer that has already spread. Ovarian cancer plays a crueler version of this game. Its early symptoms are vague bloating, feeling full quickly, pelvic discomfort. There's no perfect screening test for average-risk women. So many cases are found late. The practical message here is to take any new, persistent, and unexplained symptoms to your doctor instead of just trying to normalize them. Chronic kidney disease follows another quiet pattern of loss. Your kidneys have incredible reserve capacity, so you can lose a lot of function before any symptoms appear. Picture someone with long-standing diabetes or untreated high blood pressure. They brush off mild fatigue or occasional swelling, assuming it's nothing. Meanwhile, their kidneys are silently failing. Early detection through simple blood and urine tests is key. It allows for interventions like tighter blood pressure and sugar control that can drastically slow the progression toward dialysis or a transplant. Routine screening for at-risk individuals is inexpensive and can be life-changing. Then there are the structural threats that give no warning until they break. An abdominal aortic aneurysm, or a tripula, is essentially a silent time bomb in the main artery of your abdomen. It can grow without any symptoms until it ruptures, which is often fatal. That's why screening, a simple one-time ultrasound, is recommended for specific high-risk groups, like older men with a history of smoking. Finding a dangerous but fixable problem allows for elective repair, preventing a catastrophe. This is a clear case where a preemptive strategy saves lives. Finally, sexually transmitted infections beyond HIV are notoriously stealthy. HPV infections are usually asymptomatic, but a persistent infection can lead to cervical and other cancers years later. This is why the HPV vaccine and regular cervical screening are some of the most powerful cancer prevention tools we have. Chlamydia and gonorrhea often cause no symptoms, especially in women, but can lead to infertility if left untreated. For sexually active people, routine screening, using protection, and getting vaccinated are practical, stigma-free tools that protect both you and your partners. So, what does this all mean for you? First, know your numbers: blood pressure, cholesterol, and blood sugar. Second, follow evidence-based screening guidelines for things like colon cancer and cervical cancer. Third, use your prevention tools: vaccines, smoking cessation, and a healthy lifestyle. The same choices that protect your heart also reduce your risk for cancer, diabetes, and other slow-motion killers. I know that fear, stigma, and just plain inertia are real barriers. People avoid testing because they're scared of a bad result, worried about the cost, or just don't want to think about it. But avoiding a test doesn't make the risk go away, just converts an invisible risk into a present danger. If you feel anxious about all this, just start with one concrete step: get your blood pressure checked. Book that one screening you've been putting off. Schedule one test. Those small, ordinary actions are the most powerful antidote to the silent diseases we've talked about. They put you back in control. Thanks for watching, and please take care of yourself.